I think we'll get started. Good morning, good afternoon, and good evening to our audience around the world. Welcome to today's webinar, Enabling Safer Food in Traditional Markets. EatSafe, USAID Feed the Future initiative activity, is excited to host today's event, which is part of WHO's Health Talks in honor of World Food Safety Day. Before we dive in, I'd like to share a few logistical notes to ask. If you want to ask questions at any time throughout today's event, please click on the Q&A button on your Zoom console. Also, today's event will be recorded, and after today's session, the recording will be accessible on the GAIN website at www.gainhealth.org. So my name is Richard Pluk. I am the EatSafe's Chief of Party and the Food Safety Lead at the Global Alliance for Improved Nutrition. I've been on the project now for nearly 4 months, and I've loved becoming part of this community. Before joining GAIN, I worked with Bayer, and before that on Feed the Future projects in East Africa. This year, the theme of World Food Safety Day, which was yesterday, is Safer Food, Better Health. EatSafe works towards this goal, focusing on a special setting, the traditional market. These markets are special because they sit at the intersection of health, nutrition, local economies, and food security, which are all underpinned by food safety. Each day, millions of people around the world access their food, including nutrient-dense foods from traditional markets. And we all have a part to play in developing a culture that delivers safer food and better health from these markets. During today's webinar, you'll hear from several distinguished experts about local markets and how we can enable safer food environments in these markets. With that, I'd like to introduce today's moderator, Reza Suman. From our GAIN Bangladesh team, Suman comes with an education background in anthropology, having more than 12 years of experience in the field of urban development, policy advocacy, and research in nutrition, focusing on workforce and keeping markets working with BRAC, the Global Alliance for Improved Nutrition, the Asia Foundation and Transparency International Bangladesh. He has led different programs with the ready-made garment sector and urban contexts in different parts of Bangladesh. Over to you, Suman.
So thanks, Richard, and hello, everyone. Good day. Actually, today we are actually discussing about the enabling safer food in traditional markets. You know, already Richard mentioned that the traditional market is the main source of food for basically the middle and low income consumers, and it's an integral part for the food system across the globe. So in this traditional market, you can find variety of fresh and nutritious food with an affordable price. We know that there is a different source like the supermarkets and others, but still now this traditional market still prevail for purchasing fresh food and meat. But this traditional market can be a major channel for spreading disease. So prevention and control of foodborne diseases in this market is very important. So today's webinar is basically one of the part of celebration of World Food Safety Day. We will discuss the way to create an enabling environment and to adopt new tools and approaches. So welcome again, everyone. I would like to go with our keynote speaker. Today, our keynote speaker is Eugenia Karora. She is basically the Secretary General of World Union of Wholesale Markets. You know that this is an international network of fresh food and products organization. Eugenia has a great experience to work with this global network of fresh products and players to accelerate the transitions. She actually also worked as a CEO of Ranjin International Wholesale Market, and she led different positions with and supported the French government and also played an advisor of the mayor of France. So now, Eugenia, I would like to present your slides and welcome everyone to Eugenia's keynote presentation. Thank you.
Thank you, Reza, so much. Thank you for these introductory words. So the first thing that I want to say is I really want to thank the EatSafe WHO, GAIN, and all the other organizers of this event for inviting me and the World Union of Wholesale Markets as speaker. I'm like really happy to be here with you today and to introduce the work of the WOM that is unknown for a lot of people. And that's why I want to start by briefly introducing our work with a short video. Okay, so I would like to share my screen if that's possible. Okay, perfect. So you can see my presentation. So you have seen the video. I think it was important for me to show you, to bring a little bit of knowledge of what is WOM. So WOM in a nutshell, we are the largest network of wholesale markets and fresh food actors of the world. So we have around actually 220 wholesale markets that are part of our network, coming from 43 different countries in 5 continents. And also, of course, because we work with a network of what we call like market system, we also have retail markets, what we call normally traditional fresh food street markets, and other actors that are working in this network and environment. So we distribute around, we supply around 50% of the global fresh food supply chain in the world. In some countries, this is achieving much more. So for instance, in China, 80% of all the fresh products go through our wholesale markets. 95% of wholesale markets, because this is something that most of people, they don't know, are public companies or are owned mainly by local or national authorities. And they were established by governments, as I was saying, either national or local governments, in order to better organize fresh food supply chain at local level. Therefore, in a way, our organization plays what we call a public interest role, and one of our priorities is to ensure food security at national and local level. So what is the importance of markets? A lot of people, let's say that for years, like market systems were a little bit overlooked by the general public and also, unfortunately, by policymakers, particularly in the most developed countries. This, historically speaking, could be explained because of the 70s, we have the development of supermarkets around the world as the main food retailer that lead to the general public to think that actually food security could be endorsed completely to the private sector. However, market systems, wholesale and retail markets, as I was saying, continue to cover a high number of functions and make them key infrastructures for the well-being of world societies. They influence health, economic and environment spheres, among others. Traditional markets have proven to be the most powerful tools to guarantee access to fresh products, mainly fruits and vegetables, and also to incentivize healthier diets. In many countries around the world, traditional food markets are today the major food suppliers and social cultural spaces for local communities, representing the basis of food security, food safety, and people livelihoods. For instance,
so Eugenia, just one thing. Could you please put your slides in the slides more specifically, because the presentation actually the
you
full
cannot
screen
see
basically. Yeah.
Okay, wait. So is that? Can you see it better there?
Yes, it's better.
Yeah.
You can. Yes,
Wait.
carry on, please.
So
thank you.
Try to see. Okay, so this is like. Can you see it like bigger? Yeah. It's good?
Oh. No, it's still the
FAOs and recent studies, and Reza is one of the authors of one of them, show that in low and middle income countries with limited supermarket penetration, citizens primarily rely in traditional forms of retail. These studies show that over 90% of fruit and vegetables produced in low income countries are sold by traditional small retailers. In this sense, markets can also play a pivotal role to ensure food safety, as they have the capacity to verify that the produce entering into the infrastructure is not contaminated, and check also the correct traceability of produce in order to minimize damages in case of contamination. This potential today in a lot of countries is not completely achieved. It could be achieved if infrastructures are modernized, and if the public sector is a little bit more involved in an efficient, in a multi-stakeholder way, with the sellers and with associations in order to guarantee this verification. COVID brought the attention back to the markets and the role to the markets to ensure food security and facilitate healthy diets, as the work was recognized as essential to avoid food supply disruptions. I will speak a little bit more about this afterwards. Today, if we can make it short, we need to find solutions to guarantee accessibility, availability, and also mainly affordability, so like to make prices accessible, of healthy food supplies. This need is today more urgent and pressing than ever in a world that is like marked, as we can see, the effects of the post-COVID pandemic, the crisis, the war in Ukraine, and the climate instabilities that we have seen, and the problems in the agricultural sector that it implied. So the need to reform the architecture of food system is more than ever essential. In this way, we believe that traditional markets within the frame of efficient market system can be great allies for governments in order to develop a central network of infrastructures that can foster healthy, inclusive, and resilient food systems, leaving no one behind. So let me go a little bit, because I was asked to focus a little on what happened during the pandemic. So COVID pandemic provoked many disruptions on the fresh food value chain, what put at risk, of course, millions of people and the nutrition of millions of people around the world, particularly low and middle income countries. They have encountered actually much more obstacles compared with other areas of the world where modern infrastructures and more tools to guarantee hygiene and prevent contamination. So the impact of COVID made, in a way, consumers, producers, and vendors understand the importance of safety in food markets. You all remember that at the beginning of the COVID, a lot of one of the test hypotheses was that it was originated in Wuhan, so a wholesale market located in China. So this brought a lot of attention also to like safety measures within markets, and this unfortunately led to a lot of governments to close retail and some wholesale markets for a short span of time, showing also afterwards the impact of that closing these infrastructures could have in the food supply. So on the one hand, this event renewed light on the centrality of the quality controls and the need to have like more standards in this regard. And on the other hand, it showed like the strength that wholesale markets and the market system can have in case of crisis. For instance, in the wholesale market, let's say that there is a really larger amount of suppliers. Most of them, they are small and medium-sized suppliers in comparison to other kind of providers as supermarkets that tends to work with like bigger contracts and bigger companies selling fresh products. Where in case of disruption, of course, these kind of infrastructures are much more vulnerable. Wholesale markets in this sense show to be much more resilient in terms of in case of crisis, because they can count upon a larger network of suppliers. What it means that the chain is a little bit or actually a lot much more robust. So another thing that happened and that COVID showed during COVID, as I was saying, a lot of governments, in order to try to reduce contaminations, they decided to close traditional markets, particularly retail markets. This the effects of this we can now have that about the effects of this in the places where retail markets were closed. We had much more demand to local authorities of food help, what means that actually low-income households relies on traditional markets in order to have access to food and to fresh food particular. Why? Because supermarket prices most of the time they are like higher. Also in traditional markets, at the end of the market you can bargain a little bit, and they are like sold products. So like low income households can have more access to this this kind of infrastructure. So what are the economic So what are the economical impact of traditional food markets? There are several. The first thing is like they are a source of livelihood for many low and middle income communities, because they provide, as I was saying, affordable food and other goods compared with other kind of infrastructure such as supermarkets. Then they can generate additional income and employment for a lot of rural regions. And as I was saying, most of the produce that is sold is national or regional produce that is produced by middle or small size farmers. They can also act, and this is something that we also forget often to name, as a catalyst for regeneration and dynamism of cities and of central areas. So they can create a lot of social cohesion. The market system provides also a lot of job opportunities to a large segment of the world population, knowing that more than 1 billion people work today in agriculture, and half of them operate, as I was saying, in a small scale level. So market system can help to drastically reduce what we call the urban-rural gap. In this sense, offering a viable alternative to conventional and other food retailers. In two words, given, I think that in the future, like what we need to make is give a new twist to traditional markets. The need for more resilience of the food systems, that is calling for a transformation of food systems and to shorten the food supplies, to reterritorialization of the production, and means also the creation of adequate networks that can sustain this new food architecture. In this sense, market system will be essential, but also, and this is really important, they need to invest in order to modernize infrastructures and create better connections and public involvement to develop successful market systems. So I don't want to be really long, so I will go under like these slides. So What is this? I was requested to focus not that much in food safety, but more in the role of market system as a central issue to ensure food security. So I think that market system and traditional markets in particular can be major actors to tackle a lot of major challenges that the food system is forced to face today. And they can hence contribute to make more resilient in case of further emergencies. They have proven to have an impact not just in lower and middle income countries, but also in developed countries. In France, for instance, where retail markets were closed, we have proven evidence that lower income households were having much less access to healthier diets. Markets are also this place where we can have, as say again, a number of characteristics of what we call like sustainable food systems that are developed. So it's crucial to put back markets and market system at the center of food policies agendas and local and national level, and also to facilitate the modernization, of course, trying to look local realities and to adapt to local realities and what can be done in terms not just of like the infrastructures, but also of the vendors and the creation of like associations that can benefit all of the actors and leave none of the actors that are composing the market system behind. But today we have guideline good practices around the world, that low-tech guidelines also, and that can facilitate this transition. WOM is working with a lot of partners to improve market system around the world. And of course, we'll be happy to collaborate with all the stakeholders pursuing this goal and to share all our expertise, good practices, and techniques in order to bring new guidance if needed, ensure better logistics, better stocking, try to find solutions also to have better cold chain. This can improve a lot contamination, and of course also the verification to guarantee that the products are safe. Thank you so very much, and don't hesitate to contact us if you want to develop a particular project, or if you're interested in some good practices of some of our markets. Thank you so much.
So thank you, Eugenia. Very impressive and very interesting that the World Union of Wholesale Market, they are working to ensure the consumers to save and nutritious. Exactly, the most of the consumers, they have an expectation to get the safe food. So definitely there might be a question to you also. I would request to participant, if you have any questions or queries or comments, please use our Q&A options. And obviously, Eugenia and the panelists will answer the question definitely. So, dear participant, today we have basically 3 panelists with us. So I would actually, first, I would like to go with Carolyn Smith. Abby, could you please close the slides? Yeah, thank you. So today we have Carolyn Smith, Delia Grace, and Dr. Agustin Ocorio. So first, I would like to go with Carolyn Smith. So Carolyn is the Deputy Chief of Party of EatSafe, Global Alliance for Improved Nutrition. She actually worked as an International Food Safety Policy Manager for FDA's Center for Food Safety and Applied Nutrition, also including advising and representing the US government in the Codex and the World Trade Organization. She actually served for over 20 years as Director of Food Safety for the Center for Science in the Public Interest. So welcome, Caroline. You know that in the traditional markets actually plays a vital role in reaching food to consumers. And I have observed in Bangladesh, basically in Bangladesh, 85% household, they buy their food from this traditional market. And also we know that the consumption of unsafe food very closely linked with the malnutrition and unsafe food practice and this traditional market can be a major channel for spreading disease. So it is important to ensure food safety in the traditional market. But do you think that food safety is a global issue? And why you think that? Thank you, Carolyn.
Well, and happy World Food Safety Day to everyone today. And thank you so much for joining this WHO GAIN-sponsored health talk. Food safety is a global issue. WHO estimates that 1 in 10 consumers become ill each year from unsafe food. But the impacts on consumers living in low and middle income countries is much greater than that. For example, in South Asia and Sub-Saharan Africa, which account for about 41% of the world population, they experience about 53% of the illnesses and 75% of the deaths linked to unsafe food. So the importance of ensuring that food is safe wherever it's sourced is really important. The other thing that's really driven EatSafe and GAIN is the fact that so many consumers in low and middle income countries rely on these traditional markets to source their fresh foods, fruits and vegetables, their meat, poultry, or fish products. Freshness is very important culturally, and these markets are seen as the source of fresh product. So when it comes to food safety, while the emphasis is certainly important at the national level, we need to help the national level drive the food safety emphasis down all the way to these retail markets where consumers are sourcing their food. So, Suman, that's why it's so important. Food safety is something that's preventable. It's something that food safety problems happen frequently, and they are preventable. So that's why it's a global issue, but it's also a national, regional, and local issue.
Thank you, Carolyn, for your answer, and also understand the global food safety is a global issue. So we have actually we have another question to you, that you have a long time work with the food safety policy and the codex as well. And we know that the codex is a standard of collection of international standards, and it's based on the best scientific and technical knowledge. So could you please tell us today that what are the available global standard for the food safety, and is any available standard for the traditional market as well?
Codex has been looking at this issue of street vended food for over 20 years. And while many of the Codex standards impact national governments and national policy, in fact, 4 regions have addressed the issue of street vended food since the 1990s. The same is true for WHO and FAO. The focus on getting better standards and better food safety conditions for these markets has been an emphasis since the 1990s. So the question is, what do we need to do to make it happen, to make sure that the better standards are being implemented at the local level where these markets are regulated? Codex has adopted 4 different regional standards for street vended food, but there is no standard specific to traditional markets. So we have been looking at the standards that are available. They may be totally appropriate. They may be out of date. Some of them look more to the prepared food products, which are street vended, versus the raw food product. But there is a lot of good information that we can mine to identify what are the right standards that need to be applied in traditional markets. So the good news, Suman, is that this issue has been worked on, and there is a lot of good thinking and regional understanding of the issue of traditional markets. But the bad news is that they haven't actually gotten to a agreed upon standard, global standard for how these markets should manage food safety to ensure that consumers are protected from unsafe food.
Thank you, Carolyn, and we are actually glad to hear that they are planning for some standard for the traditional markets. So thank you, Carolyn. Participants, now I would like to go with our second panelist, basically Delia Grace. She's the joint appointed scientist, and she's working with International Livestock Research Institute. Delia basically is an epidemiologist and a veterinarian, more than 20 years experience in this with the developing countries. She actually leads some research on the foodborne diseases with the International Livestock Research Institute. And she focused, her main focus research is the food safety in the domestic market. So welcome, Delia. In the urban area, we know that there is a lot of source of unsafe food, like the street vendors and the food carts, and per slaughterhouse practice also, and the unsafe order definitely. But could you please tell us that what are the actually food safety risks for the traditional market? In the traditional market, what is the food safety risks? Delia, please.
Yes, it's a pleasure to be here on behalf of my two institutes, ILRI and the Natural Resources Institute in the UK. We've been researching food safety in informal markets for over 15 years now. I would say it's a very under-researched area, which means it is quite hard to know accurately what the risks are. Wherever there's a couple of points I can say. One is that risks are very context specific. So just because you've done one study in a market in Vietnam and find, for example, salmonella is a problem in pork, it doesn't necessarily mean that you're going to find the same if you do a study in Uganda. It might be there that's something else. It's the cysticercosis, pig tapeworm, which is the big problem. So one point we've learned is context matters. Another point we've learned, and this is a little bit unfortunate, is that when we look for hazards, no matter what the hazard is, from aflatoxin to chemicals to pathogens, we tend to find them, often at quite high levels. But here I would add, and it's very important and very confusing because it's not really understood by most people, that while hazards are very common and very ubiquitous, risks may actually be quite low. So a hazard is something you don't want in your food, like a chemical or a pathogen, but a risk is the chance that you'll get sick and how sick you get. And it could be that a hazard is quite high, but because of things that happen along the farm to fork chain, your chance of getting sick and ill is quite low. And the reverse could be true. A hazard could look very low, but consumed over a lifetime, it could be quite enough to give a lot of people cancer. So that's our second message. Hazards are not risks, and hazards can be high and risks low, and vice versa. And then my third message, I would say the third learning from research, and again, this is a little bit counterintuitive, is that the market kiosk is not always risky and the supermarket is not always safe. So for example, we've done some studies in Vietnam where we found that meat sold wrapped in cellophane in chill cabinets in supermarkets actually had higher microbiological loads than the meat being sold with no cold chain on wooden chopping boards in the traditional markets. And there were reasons for this, but it really surprised the stakeholders who, when they see a modern, shiny supermarket with lights and cabinets and everything, they assume it's safe and vice versa. I'd just like to quickly finish up by endorsing what Caroline said, and I think her cat also agreed with this, that informal markets are not just only about risks to human health and hazards. And I think Eugenie was also flagging this up. They provide incredible benefits to people: nutrition benefits, livelihood benefits, equity benefits. These markets are often dominated by women, and also social benefits, cultural benefits. They often sell foods which are highly desired and unobtainable in modern food systems. So we mustn't throw out the baby with the bathwater when we're trying to make markets safer and highlighting the risks in these markets. We mustn't forget all of their many, many benefits. Thank you.
Thank you, Delia, for your nice response of the something that on. You have a great experience with the research and basically the domestic market. So in the during the COVID-19, basically again have worked very closely with the market association and vendors to improve food safety in the traditional market. But today we want to know you from that. Actually, is there some proven strategies that have worked in the traditional market to improve food safety? So please let us know what is the proven strategy. Thank you.
Again, traditional markets, and people alluded to that, like street, in its broader sense, of course, informal markets cover street vendors, eateries, everything. But if you're thinking about the actual markets, kind of open, what we think of as a market, an open area with lots of kiosks and people selling things, they have really been neglected. There has been very little work in these markets. The work which has been done, and actually I would say quite a lot of it has actually been done by our research group, has been, if I may summarize, promising in the short run, but a little less hopeful in the longer term. And again, I think it's been said that pilots never fail and pilots never scale. So what we have found in many incidences is that, yes, we have done interventions. They've been very popular. There's been a lot of uptake. They have definitely improved food safety. But now when we have started to come back looking, years later, sometimes, that unless there are changes in institutions, in governance and policies, these improvements which are brought about by projects, by interventions, are not always attained. So I think it's a combination of working, through initiatives, through projects, but then also looking at the policy and governance environment to try and ensure that these shorter term improvements and impacts really do get translated into longer term benefits. Thank you.
Thank you, Delia. Yes, we have also actually in Bangladesh, particularly, we have some great experience to work with the government, policymakers, and as well the market associations. They supported us. So it is important basically to keep all of the stakeholders in a table to work together. So dear participant, if you have any question to our panelists, please put this in our Q&A box. We will definitely, our panelist and the keynote speaker will respond. So now I'd like to go with our another panelist, Dr. Augustine Okoriwa. He is the actually head of EatSafe country programs, Global Alliance for Improved Nutrition. And Dr. Augustine is a food technologist and post-harvest specialist. He worked as a post-harvest researcher at the International Institute of Tropical Agriculture for over 10 years. And Dr. Augustine is a fellow of the Nigerian Institute of Food Science and Technology. So welcome, Dr. Augustine. We know that the rapid and unplanned urbanizations and the growing demands and changing consumers' behavior, basically, and the proper operation and absence of infrastructures, adequate infrastructure, are the main challenges for the traditional market. But along with that, the market association and the government can also come forward to mitigate the challenges. So based on the gains work that have done in the traditional market, could you please let us know what is actually the responsibility of the government side to improve the food safety in traditional market?
Yeah, thank you very much, and welcome everyone. The government is a critical stakeholder in ensuring food safety in traditional markets. The EatSafe project has recognized that from its inception and decided to engage with the federal government and the state government. Our entry into the states where we work started with engagement with the ministries, departments, and agencies. And as it relates to policy and legislation, this is a key responsibility of the federal government of Nigeria, where it will start as a national policy and then cascade down to the state and local government area councils. As of today, Nigeria can be said not to have a food safety policy, in the sense that the current food safety policy and its implementation strategy that was produced in 2014 has currently not been backed up with the food safety and quality bill that was also developed in 2016. EatSafe is involved in this current review of the food safety and quality policy document and also the food safety and quality bill 2022. So critically, the government have to understand that inclusion of traditional markets in the policy document and in the food safety quality bill is a requirement. So globally and in the low and medium income countries, we expect that in the formulation of policies and legislation, that traditional markets, which is a subset of the informal sector as a whole, should ensure that the traditional markets are included in the policy document, included in the quality or legislation bill. For example, using Nigeria, over 70% of the population purchase their food from traditional markets. Therefore, it behoves the government to take responsibility in ensuring that the policy formulation and legislation for an effective food control system recognizes the traditional market. Thank you.
Thank you, Dr. Augustine. It's important basically to the legislation and to come forward the government as well in the policy level. So could you please also can let us know that how can the stakeholder that is actually relevant with the traditional market, they can advocate for the creating platform to improve food safety in traditional market? How they can play the advocate role?
Yeah, thank you very much. For the EatSafe project, as an example, we engage stakeholders that comprise the government, the private sector, consumers, vendors, market management, market association. And the purpose is to let every stakeholder understand their role and their responsibility. And as part of moving that forward, the EatSafe project have decided to put all the stakeholders together by forming an association called the Association for Promotion of Food Safety and Improved Nutrition, to bring together the stakeholders from the farm to the table and to specifically define the roles that each stakeholder with the consumer as at the receiving end, who is actually impacted positively or negatively, depending on how food safety is managed in the food system, to understand their role, to be able to demand for safe food as a right. And what we're doing currently is to also engage the market management, specifically market associations. And from the beginning of the project, we engaged them and we had very good buy-in from the market association, and they are taking responsibility that they have a role to play, and they are looking forward to actually implementing our design interventions in the marketplace. They are looking forward to that, and so they are taking responsibility, ownership, awareness, sensitization, mobilization. And I want to also add, for every stakeholder, food safety also is sometimes an application of common sense. Thank you.
So thank you, Dr. Augustine, and thank you all our panelists and also keynote speakers. And we have already a lot of actually questions that need to be already we have answered, but definitely we will try to answer most of them. The question is that between traditional market that sell raw food like vegetable, fruits, poultry, etc., compared to street vendor that sell prepared food which one carries a higher food safety risk, and also comment around the different risks. So it is important. Okay, we will definitely answer. And one question is basically the farmers are contaminating the food supplies, and farmers are now utilizing pesticides. So what can we do to assure food safety before it's come to local fresh market? So our panelist or Eugenia, you can also answer these questions. How can we assure food safety before it comes to local fresh markets?
Yes, I mean, I think that the approach which has proven very successful is what we call the farm to fork or boat to throat approach, which means that you should assure food safety all the way along the chain. And this requires something which food safety people call risk assessment. And that involves looking at the farm to fork chain and finding out where risk is introduced and where it can best be mitigated. This isn't always on the farm. And sometimes when things are introduced in the farm, they can actually be better mitigated off the farm in markets or even in households. But in the case of pesticides, it's very difficult to reduce these a lot further down the chain. So it really is a question of working with farmers to give them alternatives to use of pesticides and set up systems whereby if they do use pesticides, this can be detected and therefore they can appropriate action can be taken. And there are some very encouraging initiatives. I think around IPM, integrated pest management, for example, has been very successful and really does provide tools which will allow farmers to reduce their use of pesticides. Thank you.
Thank you, Delia. And now the question is to Carolyn. Carolyn, is actually there is a question that in developing global guidelines and standards, how do you intend ensuring that the peculiarities of each region in terms of weather, conditions, and population, and the educational status, and so on, play in ensuring food safety?
Thank you, Suman. That is such a great question. And as Delia pointed out, there's a difference sometimes between hazard and risk. And that difference can vary culturally. It can vary depending on whether consumers are used to eating raw foods in a particular culture or whether they're used to fully cooking everything they eat. And that can vary from country to country. The good news, though, is that food safety is really a scientific question. The introduction of pathogens and their control along the food chain, from the farmer all the way through to the consumer, can be managed to prevent foodborne illness. And what we're looking for with global standards that we, again, want them to trickle down to the local level to make sure we're all enforcing the right scientific standards. The importance here is, do we need to take certain steps to control the introduction of pathogens, or if they are there, whether they survive? There was a question also on from the audience on whether prepared foods, the street vended foods, prepared foods are higher risk than the foods that are raw. And again, it's all in the handling. A street vended food can be perfectly safe because everything's cooked out. It also can carry some toxins from how it's handled after cooking. Raw foods can carry pathogens into the house. So a consumer bringing it home can cook it very thoroughly, but if Salmonella or Campylobacter has been allowed to spread in the household, then people can still get sick from that raw product, even though it was fully cooked. So the question is, what are the essential safety standards that would go into global guidance? And those should be science-based and they should be uniform so they can be applied across different cultures. Thank you, Suman.
Thank you, Carolyn. We have another question. A big problem with the traditional market.
Reza, can I add something?
Yeah, definitely.
Yes.
Yeah, you can.
So I wanted to add something to Delia and Carolyn, and thank you so much, because this discussion is being like so rich. As Carolyn was stating before, like food safety is something that we can prevent, and that's a good news. If we give an historical perspective on food safety, for instance, in today developed countries, we can see that the percentage of people falling ill or dying out of food contamination was much higher than today, showing that actually we can pass like different kind of like laws, frames, and also verification, like as Karen was saying, veterinary or also like different measures that can avoid food illness and can improve much more food safety. And this actually a lot of countries think that this is really costly, and it's not that costly. This is a lot about culture and a lot about like education. And coming back to what Delia was saying about like this approach of like from farm to the fork. Of course, if the produce is have any kind of contamination at the farm level, for instance, in case of chemicals or things like that, this is the first step where it should be solved. But as I was saying before, in a lot of countries, a lot of fresh produce are going through wholesale markets. So in that way, wholesale market, when they become modern and they apply let's say like regulations, they can become a really good buffer in order to guarantee that the food coming through the wholesale market will go safe at the level of the retail. For that, we have veterinary service inside of wholesale markets, and we can have, we're asking also for a lot of different certificates in order to guarantee the safety of the product. So in this sense, I think that in the future, if we are really trying to reterritorialize and give like a new age of goal, let's say, to markets and market systems, wholesale markets can really work as pivotal actor in order to reinforce and ensure more food safety. Thank you.
Thank you, Eugenia. Definitely, this is very informative also for the participants. So there is a question to Augustine, a big problem with the traditional market is lack of officials and the legal recognitions. So is there experience from any country that establish an official and legal recognition for food safety for the traditional market and to safeguard public health?
Yeah, thank you very much. Before I answer that, it's an important question from Nigeria that is talking about what is EatSafe doing? What are we doing about using carbides to quicken the ripening of fruits in Nigeria? EatSafe has collaborated with the Federal Ministry of Health, National Food Safety Management Committee, and market authorities in the Federal Capital Territory to mobilize action for this. On the 6th of this month, we collaborated with the markets in FCT to do a training for market food safety champions and watchers. And we had a training for them. And yesterday, during the World Food Safety Day celebration, the Federal Ministry of Health inducted 11 of them as market food safety champions and watchers. And part of the discussions during the training was the dangers of using chemicals, carbide for ripening plantain, sniper for beans, and several others. So the market authority, including the general manager of the market, the vendor association leaders, were trained, including men and women. And they have been deployed to their various markets. And this is just the first set and a continuation. And also sequel to that, the Nigerian Institute of Food Science and Tech Lagos chapter have been involved in street food championship, providing food safety knowledge. And as a member of that profession, we have been supporting them as well. Even last year, we did that, supporting their activities. And on the second question, I did say that For countries that are outside Nigeria, there are some of them that have some guidelines for traditional market. But in terms of harmonization, there is really nothing currently harmonized for traditional markets. Thank you.
Thank you.
Sorry, I'd just like
yes.
to add quickly there that yesterday, the African Union launched the first ever Africa food safety strategy, which all the member countries had been consulted on and had endorsed. And it, for the first time, I think, really does highlight the role of traditional and informal markets. And it provides some principles, which, if followed, could certainly improve the way food safety is managed across Africa. So I think that's been a great step forward through the African Union. Thanks.
Thank you. And thank you, Delia. Just briefly, could you please let us know that how can food safety culture develop in society, basically?
Yes, I think the first thing is is that it won't happen unless it's planned, and too often it hasn't been planned. So interventions have focused on very sort of technological things, like training people how to maybe do a different solar drying or a different type of processing, or else they focused on providing infrastructure, you know, the sort of the hardware, but not the soft skills. And we've actually done research which has shown that when infrastructure is upgraded, but it's not accompanied by soft skills, things can actually get worse. That it's not even that they stay the same, but food safety can get worse. So really, I think the first thing is that people need to be aware of food safety culture. Even the phrase is not widely understood by all stakeholders. And then that when food safety interventions by NGOs, governments, market authorities are being carried out, they think not just about infrastructure and not even just about training and raising awareness raising, but also about changing the mindsets and growing food safety culture. Because I can tell you from having been around informal markets in every part of the world, there is not a food safety culture in most of these markets. Thanks.
Thank you. And the relevant question to also Caroline, that when actually we considering the way the traditional market is actually evolved in most developing countries, so do you think that we will ever have unified safety standards? And considering that safety issue is in this markets, how will we start from infrastructure on municipality service? Thank you.
Thank you, Suman. So the key to standards is ensuring that they impact the market from each point. So it can impact the infrastructure of the market, making sure that local authorities understand the importance of, for example, access to potable water and waste management within the markets themselves, which is something that has to happen above the level of the vendor, to how vendors source the food, and availability of sanitation in the market. So these standards aren't going to be culturally unique. They're going to be standards that apply across the board. And critically important is having buy-in, as Augustine mentioned, having stakeholders understand the importance of having standards and applying them, because empowering markets to build in these safety protections and build in programs, for example, for training vendors. Empowering markets means we also have to really engage the local governments. So the work that EatSafe is doing in Nigeria doesn't stop at the national level. We're working at the local government level, at the level of market authorities, and each of these need to be engaged. Each of these levels, each of these people need to be engaged, touched, and consulted if the markets truly are going to be safe. But first, we need an understanding of what is needed to truly improve market conditions and protect food safety. Thank you, Suman.
Thank you, Carolyn. The last question to Eugenia. One of the challenges is the cost of food safety for micro and small, medium enterprise businesses. So who are processing basically for the traditional market? So can anyone address these challenges? That actually a question.
Yeah, so thank you so much, Reza, and thank you for the question. I think that, as I was saying before, and Carolyn and Delia said it again, this is about also as to develop a culture of food safety. So the first thing is understanding what is food safety, because a lot of stakeholders that we're working with, they don't really understand in which way the practices, the daily practices that they're doing are, let's say, diminishing the food safety and during the manipulation of the products. So this culture is, I mean, the price will be the price of probably mobilizing a multi-stakeholder approach with local authorities, and probably by organizing also at the level of the markets, association of vendors and other kind of networks that can afterwards share this knowledge and, let's say, try to endorse this knowledge in a positive way. So not by, let's say, like a strict regulation that maybe at the beginning should be that could be one of the alternatives, but it's not really about the cost, but it's about a culture, and a culture can be learned and can be shared and can be trained in, and then should be adopted in the long term. So and this for a society, when we can see where unfortunately most of the people that are dying out from foodborne illness are in really low income countries. So the cost of it actually now is much higher than what we think.
Thank you. Thank you, the panelist, and also Eugenia. Now, Richard, I will go back to you. Thank you, the participant.
Thank you very much. I wish we had more than an hour. There was some really good discussion. We were just starting to get our teeth into some of these issues that I know we're all kind of really important. We find really important and want to learn more about. But all good things have to come to an end. So with that, I'd like to thank you for joining, and also a very big thank you to our presenters and to our keynote speaker. For more information about EatSafe, please visit us on www.gainhealth.org/EatSafe. So thanks again for joining us, and as always, stay safe and eat safe. Thank you.
Thank you, everyone. Thank you.